Hello everyone, my name is Brian, and for today's digital pathogen assignment, we will be discussing hepatitis. So, what is hepatitis? Hepatitis is the inflammation of the liver. It is occasionally the result of infections by other viruses, including the Epstein-Barr virus, cytomegalovirus, herpes simplex virus, yellow fever virus, measles, mumps, and chickenpox virus, and the hepatitis viruses themselves. Some history of hepatitis. In the 3rd millennium BC, the first description of hepatitis was found on clay tablets in Samaria. The etiological agent was a devil by the name of Ahazu, who attacked the liver, which was referred to as the home of the soul back then. In 460 through 375 BC, Hippocrates described the first clinical features of epidemic jaundice, including sudden onset and death within 11 days. The recommended treatment was a diet consisting of honey and water. The word icterus, meaning jaundice, was first found on the Hippocratic corpus, shown on the lower right over here. This is a collection of texts and research during the time of Hippocrates in no particular order, lectures included. In the 8th century AD, Pope Zacharias quarantined afflicted individuals to prevent its spread throughout Rome. In the Middle Ages, jaundice was thought to be a curse on those considered impure and are to be avoided and isolated. 18th century, many epidemics were reported during military campaigns. During the American Civil War, there were 52,000 cases of hepatitis reported. In 1885, individuals who were vaccinated with the lymph or interstitial fluid from previously exposed smallpox individuals fell ill with jaundice, proving transmission through contamination. World War II, the death toll was estimated at 16 million by hepatitis, and around 50,000 reported cases of jaundice among U.S. Army soldiers following administration of yellow fever vaccination containing human serum. In 1963, the hepatitis B surface antigen was discovered, and the picture on the top right here shows a man with jaundice. It is the yellowing of the skin and of the whites in your eyes. Signs and symptoms of acute viral hepatitis are viremia, which leads to flu-like symptoms, nausea, vomiting, abdominal pain, fever, fatigue, loss of appetite, rash, and joint pain, which is less common, jaundice, dark urine, and or clay-colored stool. The most common types of hepatitis are A, B, and C. Starting with hepatitis A, it is a single-stranded RNA, lacks an envelope. It can be grown in cell culture. Its routes of transmission are fecal oral or the consumption of contaminated food or water. The virus starts by multiplying in the epithelial lining of the intestinal tract, then spreads to the liver, kidneys, and spleen. The virus is shed in the feces and can be detected in the blood, which is diagnosed with detection of IgM, anti-HAV. Food handlers may not appear ill, but may still spread the virus. Resistant to chlorine disinfectants at concentrations ordinarily used in water, enhancing fecal contamination of food and drinks. So that is a common reason why when you see healthcare, or not healthcare, but food service workers, they need to regularly wash their hands, especially after using a restroom, because it's very common that, like, if they were to wipe, there is a possibility that some fecal matter might have gone onto their hands, and even though it might not be seen, it might still be present, which is why it's very important to wash their hands or wash your hands whenever dealing with food. There is 50% of infections are subclinical, meaning they're not severe enough to show observable symptoms. Clinical cases last between 2 to 21 days. The incubation time is within 2 weeks to 7 weeks, or 15 to 50 days, with an average of 28 days average. There are no chronic forms of hepatitis A, and recovery from hepatitis A results in a lifelong immunity. Treatment options include immune globulin for those at risk or have been exposed to hepatitis A. So you could take it as a pre-exposure prophylaxis, or PrEP, or as a post-exposure prophylaxis, or PEP. And you can take it as an activated vaccine, which is common for travelers who are going to endemic areas and the high-risk groups such as homosexual men and injecting street drug users, or IDUs. It's also part of the recommended vaccination schedules for both child, adolescents, and adults. The hepatitis B facts are that it is a double-stranded DNA and it is enveloped. It is the only one out of the common ones that deals with DNA, as you'll see. Its route of transmission is through sexual contact, blood, and vertical, meaning mother to child. Serum collected from hepatitis B patients contain 3 distinct particles: the virion, which is the largest part, right here, if you can see my cursor, also known as the Dane particle, the spherical particles, and the filamentous particles. Detection of any of these things or showing positive of these things during the serum test will give you an idea of the current status of the patient with hepatitis B. So if the patient shows positive for hepatitis B surface antigen, or HBsAg, it shows that there currently is hepatitis B present in the blood. If they show positive for hepatitis B antibody, or anti-HBsAg, the patient is immune. And positive for the hepatitis B E antigen means that the virus is replicating vigorously. There are more than 350 million worldwide cases, or not cases, but chronic carriers of hepatitis B. Most carriers are of Asian or African descent, which they acquire at birth or the first couple of years of birth. 5% of acute cases progress to chronic hepatitis B. Less than 1% develop fulminant or sudden onset hepatitis, which leads to sudden massive liver damage. The treatment options include the hepatitis B vaccination, immune globulin, HBIG, antivirals, alpha interferon, lamivudine, adifovir, entecavir, telbivudine, and tenofovir DF, and the last resort is getting a liver transplant. Some facts about hepatitis C is it is a single-strand RNA and enveloped, as opposed to the hepatitis A virus, which is unenveloped. Its route of transmission is through the blood, but it is also commonly found with transfusion patients. It is the major reason for liver transplantations. There is a 70 to 80 day interval between when the patient is infected and the appearance of antibodies within the body. Blood collecting facilities can detect contaminated blood within 25 days, or by performing a PCR test, it can be detected within 1 to 2 weeks after infection. Hepatitis C triggers an immune inflammatory response, which can either clear the infection or can slowly destroy the liver. Hepatitis C is considered clinically inapparent, often only detected during routine testing, such as for insurance or blood donation. I want to say that the insurance part is referring to when applying for health insurance, patients need to prove that they did not have um, an ongoing infection or an ongoing condition. I forgot the actual verbiage behind that. Pre-existing condition prior to applying for insurance as to avoid insurance fraud. And obviously, blood screening. Whenever you donate, you answer questionnaires like, have you been exposed to anybody with so and so? Have you traveled outside the country? I digress. Majority of the cases, which can be anywhere from like 60 to as high as 85%, progress to chronic hepatitis C, which is the most chronic out of all the hepatitises. 25% of those with chronic hepatitis C develop cirrhosis or liver cancer. Currently, there are no treatments or vaccines, I'm sorry, for hepatitis C. However, there is enzyme inhibitors with the combination of protease and polymerase, which are the two enzymes, interferon and ribavirin. Those infected with hepatitis C should be immunized against both hepatitis A and B. There is the option of taking the combination vaccine, which we will discuss later, to reduce risk of further liver damage. So, onto the available vaccines. There are the vaccines for hepatitis A and B. These can be given both to adult and pediatric and adolescent. I worked with the pediatric versions of these when I worked at my pediatric clinic, obviously. So the two individualized hepatitis A vaccines are both Vacta and Havrix. This one right here is Vacta. As you can see, it is the adult formulation. And the two hepatitis B vaccines are Engerix and Recombavax. So if you needed to get immunized for both hepatitis A and B, there is the combination vaccine called Twinrix. And these are the intervals right here and the time at which you take them apart. So the less common hepatitis viruses include hepatitis D and E. Hepatitis D, its route of transmission is through the blood. It occurs either as a co-infection, acute case, or a superinfection, a chronic case. Those co-infected with acute hepatitis B will typically shed the hepatitis D as it clears the system. Superinfections are accompanied with progressive liver damage, and fatality rates are several times that of people infected with hepatitis B alone. In the United States and Northern Europe, hepatitis D occurs predominantly in high-risk groups such as IDUs or injecting drug users. The treatment, there is no current treatment for hepatitis D alone. However, having the hepatitis B vaccine is considered protective. Hepatitis E, its mode of transmission is the fecal-oral, similar to that of hepatitis A. It is clinically and structurally resemblant of hepatitis A. It is very common in endemic areas with poor sanitation, especially India and Southeast Asia. Hepatitis E, like hepatitis A, is not chronic, so the only two chronic hepatitises are hepatitis B and C. However, its mortality rate is over 20% in pregnant women. Currently, there are no treatments for it. So the now. In 2015, the World Health Organization, WHO, estimates that 257 million people had hepatitis B and 71 million people with hepatitis C worldwide. Global coverage with 3 doses of hepatitis B vaccine was 84%, and 39% of children received a dose at birth. And that's worldwide. So obviously, working at the pediatric clinic, I know that like we're supposed to administer the hepatitis B within like their first month, and it's more it's most common that whenever we receive new patients, that we check to see if they've been given the hepatitis B vaccine upon childbirth. That's just to protect that passing of the virus from mother to child via the vaginal or birth canal. There are only 10% of hepatitis B and 20% of hepatitis C patients that knew that they were infected around the world. In 2016, the WHO called for global elimination of viral hepatitis by the year 2030. Their targets are a 90% reduction in new cases of hepatitis B and C, 65% reduction in its mortality, and an 80% increase of treatment of people living with the infection. And the future, this was a direct quote by one of the articles listed in the bibliography at the 2013 International Liver Congress, New Approaches to Eliminate the Hepatitis B Replication Templates by Modulating Host Processes such as epigenetic mechanisms and hepatocyte generation, showed promise and may offer a potential cure in the future. So they're saying just not just a vaccination, but an actual cure, as in like eradication of the disease. As of 2014, there are studies to eradicate the CCC DNA, the template for the transcription of viral genes from infected cells. And also, there are second generation antivirals with different viral targets in interferon free hepatitis C therapy under development. And these are my references.